Good afternoon, everyone. Thank you for joining our monthly webinar series. I hope everyone is doing well under the circumstances. In today's session, we are examining the link between employee mental health and short-term disability, along with providing empowering strategies to support the mental health of your workforce, both on the job site and remotely. My name is Brynn Blackwood, and I'm an employer benefits specialist with Maximus Rose. And I'm joined by two speakers today, Jessica Savage, a registered psychotherapist at HeadWay Clinic, and Tania Fuschino, Vice President of Operations at Acclaim Ability Management. Our main takeaway today is straightforward. Understanding and acknowledging mental health is key to reducing the occurrence of disability leave. Increasingly, short-term disability leaves are mental health related because awareness has greatly increased and the shame and stigma of addressing a mental health issue has also reduced. It's becoming a more central topic of our lives. Although these issues aren't physically identifiable, they affect a person's daily living, their ability to eat, sleep, socialize, take care of themselves and their families, and perform their daily job functions. Furthermore, pain survives and flourishes in isolation. Understanding this and providing workplace resources for employees who are struggling with a mental health condition, creating a work culture that is supportive, and familiarizing oneself with early identification of warning signs can all help an employee continue to earn their full income at work, be present and productive, all while receiving essential support. We want to build a preventative culture around mental health, just like health and safety. Today's agenda. We'll start with an introduction on mental health from Jessica, and we'll then examine the link between mental health and STD claims in Canada in general. We'll look at Maximus Rose's short-term disability support toolkit. We'll then listen to Tania speak to Acclaim Ability Management's experience with their own book of business in mental health and short-term disability. And then Jessica will present HeadWay Clinic strategies for employee mental health that can be implemented in your workplace. She'll also speak to us about supporting employees working remotely, and then we'll have a question and answer period. And now I will pass it over to Jessica to speak to us about mental health.
Anyone, regardless of age, ethnicity, sex, or income, can suffer from poor mental health and develop a mental health disorder. No one is immune or invincible to the struggles that poor mental health can cause. So when we talk a little bit more about understanding mental health, we're referencing like what mental health is. So when someone references poor mental health as a whole, it means that they're struggling to cope with those daily stressors and are emotionally, cognitively, and/or behaviorally unwell. So poor mental health can cause significant problems in a person's sense of self, as well as their quality of life. It impacts 1 in 5 Canadians, so it's very likely that someone you know is struggling with their mental health in some way. Yet, approximately 60% of people who are struggling are reluctant to seek out help or support because they're afraid of being labeled or judged. So as much as we are working to reduce the stigma, it's still there for people. And this is why understanding and talking about mental health is so important. Given the fact that adults spend the majority of their waking hours at work, the workplace as a whole can play a really important role in helping to reduce that stigma and raise awareness, while also supporting those who may be struggling. So when we talk about mental health, it's important to know the signs and symptoms of poor mental health. So these can vary depending on the person, but most commonly there's things like irritability, withdrawing behaviors, confusion or distractibility, changes in mood. We can see an abuse of alcohol or drugs, fatigue. There's a lack of personal hygiene or changes in one's physical appearance. It can also be a lack of interest or just a general apathy, as well as impulsivity. So in the workplace, these symptoms may present more subtly, in the form of, changes in work habits. So if someone starts submitting things late, or there's several mistakes in the things that they submit, if they have a lack of attention or focus in meetings or in the assigned task itself, there can be changes in demeanor. So not as engaging in conversations as maybe they used to be. There's also an unwillingness to participate, or completely just avoiding in general meetings, team building activities, etc.
All right. Thank you, Jessica. We're all aware that rising employee benefits costs increasingly challenge a company's bottom line because rising disability claims have a dramatic impact on benefits premiums. In Deloitte Canada's 2019 Blueprint for Workplace Mental Health programs, they uncovered the costs of poor mental health in the Canadian workplace. A third of STD and LTD claims are related to mental health, and they represent 70% of total disability costs in the workplace. The cost of poor mental health to the Canadian economy annually is $50 billion, and that's comprised of both direct costs, such as the costs of therapy, prescription drugs, hospital stays, the costs of when poor mental health exacerbates the negative impacts of another chronic illness, such as the comorbidity of an anxiety disorder, such as panic attacks and asthma. Counseling, paramedical services, and of course, income support, such as short-term disability and long-term disability payments, which are typically 2/3 of an employee's regular income. The $6 billion figure represents the indirect costs of mental health to the economy, which are absenteeism, presenteeism, the high cost of turnover, hiring, training, etc. Further, it's uncovered that mental health claims are rising by 0.5 to 1% every year. And if we look at the graph to the right, sorry that it's a little blurry, but that's pulled from the Deloitte study as well. And this represents the number of STD claims per 1,000 full-time employees in dark blue, and the number of mental health claims represented in the turquoise color. And we can see that that's comprising over the 2016 to 2018 period about 30 to 35% of all claims. Further uncovered by the Deloitte study is that there is a direct return of investment of $1.62 for every $1 that employers invest in a workplace mental health and wellness program. So I'll be sure to include this study when we send out the recorded webinar as well, because there's a lot of great information. And you may be wondering what some of the programs with the highest ROI uncovered in the study were, so let's take a look at the next slide. So these programs are savings tools that provide a direct ROI to employers and are proven to decrease the occurrence of STD claims, reduce absenteeism and presenteeism. These tools can be added to your benefit plans to make it more comprehensive, and later Jessica will be sharing strategies with us from a psychotherapeutic perspective that can be incorporated as well. So one of the most familiar tools would be EAP or EFAP counseling, employee assistance or employee and family assistance programs. These provide confidential short-term counseling services for employees and their families facing a multitude of personal difficulties. You can use it to access counseling for marital issues, mental health, gambling, addictions, job stress, grief, elder care, etc. Speaking from personal experience, my family member went through a difficult marital separation last year and utilized his EAP for legal advice, connections to local family lawyers, and mental health counseling. It's typically telephonic counseling and often connects employees with local resources, which is great, especially for employers who are in Northern Ontario or outside of the GTA and may have a hard time finding mental health care practitioners. The key to uptake in EAP utilization by your employees is the promotion of the service. especially during this pandemic when many people are facing anguish. Another tool in our kit is virtual care. Virtual care is not only a fantastic investment because it connects your employees with a doctor through virtual video chat or text almost instantaneously and reduces strain on the public healthcare system. But now we're seeing in the last year or so, virtual care providers are offering a mental health care component. It's usually an add-on. And this can expedite access to a psychological care practitioner and therapy, typically within 1 week, as opposed to in the public healthcare system waiting 6 months, 12 months, or more, depending on where you're located. So these include stress management programs, virtual cognitive behavioral therapy, sessions with therapists, and it's an excellent add-on to workplace wellness. Third is pharmacogenetic testing. Pharmacogenetics is a very simple, non-invasive genetic test, such as a cheek swab, that can determine how an individual will respond to medications before they're actually prescribed and ingested. So this allows practitioners to prescribe a prescription that the employee's enzymes have already been identified as responsive to. This makes it easier to prescribe a medication and is great for people who may be struggling with finding the right antidepressant medication, for example. This will reduce the switching of medications until the right one sticks. A few other honorable mentions are paramedical coverage, massage therapy, physiotherapy, and coverage for counseling and mental health in person, such as psychotherapy and psychology. And fourth, Acclaim Ability Management. They provide disability case management services to employers. We are partners in this endeavor together with Acclaim, and we work alongside one another to reduce the duration of disability claims. So with that said, I'll pass it over to Tania to speak to this in full.
Perfect. Thank you, Brynn, for that. I'll take a deeper dive in putting some of the information that both Brynn and Jessica has shared into context as it relates to short-term disability, specifically with absences that are impacting your organization. So before we dive into that, to give you an understanding of the sample data that I'll be using from our specific book of business, in 2019, Acclaim managed just over 20,000 claims within the year. And that was across the country, across a variety of different organizations and employers from varying industries to different sizes, across approximately 450,000 lives in Canada. What we found in terms of our disability management strategies across various injury and illness categories was that the average duration of lost days for an individual absence in a company would range between 26 to 30 days. Now, when we look at that average duration of time, there are a lot of factors that are built into the success of the reducing the duration of lost time, so that it can really, in a positive way, have an impact on your organization's bottom line. So the shorter a duration is, obviously the costs are reduced, and there are effective strategies to achieve these desirable results with a shorter duration, specifically when we look at the impact that mental health has and the duration of mental health claims to a short-term disability offering. So moving into the next slide, specifically around mental health, as Brynn spoke about earlier, in terms of the ROI, there's both built-in preventative measures and then effective case management. So of course there are programming and solutions and strategies that organizations can implement from a preventative standpoint through many of the partnerships that Maximus Rose offers, as Brynn has mentioned, that would act as a preventative measure when addressing mental health conditions within your employee population in your organization. But then, of course, there are some individuals who are impacted by mental health to the point of disability where they can no longer function for, either an acute or an extended period of time as it relates to their mental health condition. So in Acclaim's book of business, across those 20,000 cases that we managed in 2019, and similar to the general Canadian statistic that Brynn has mentioned as well, in Acclaim's book of business, about 30 to 40% of the claims managed, so short-term disability claims only, had a mental health component, whether it was the primary reason why the employee was unable to attend work or a secondary reason. So perhaps they were struggling with a different injury or illness, perhaps let's say a cardiovascular or cardiological condition, and there was a secondary component of mental health, whether that be anxiety or depression, that developed afterwards. So whether it's a primary or secondary reason, it is impacting employees' ability to carry on their function in the workplace, and that's across a variety of industries. When we look at the average duration of days in short-term disability where an individual who is impacted with mental health may be absent from work, they're averaging at around 39 days. So something that, in order to achieve that, shorter duration in the claim, there are a variety of tools that organizations can implement to effectively address mental health in the workplace. So some of those protocols for claims management, implementing a mental health component within your disability management program and offering to effectively address mental health cases, mitigating any barriers to access to treatment. So instead of having an individual off for a prolonged period of time, and part of that duration of absence is because they can't access the right resources, or they're on a lengthy wait list to see the specialist that's required, to either prescribe the right medication. So looking for ways within your disability management offering and in your program to mitigate any barriers or delays with accessing to these resources or treatments, and effectively managing those mental health cases. Coupled with any in-house tools that your organization may have, again, through your partnership with Maximus Rose, as Brynn mentioned, there are many services, whether that's through EAP or EFAP, through your paramedical coverages, so understanding how your employee population is accessing these benefits. Are they utilizing these benefits, knowing that if mental health is impacting your claims and the absences, what resources are available to your staff and to your employees so that they can effectively manage their condition, have the appropriate coping mechanisms so that they can effectively return to work. And in that transition to return to work, it's important that they have the right tools so that they can stay at work and they can continue to function successfully while they may still be managing their condition. When we look at the types of mental health conditions that specifically impact duration of absences, the leading category is depression at 35%, anxiety at 26%, and adjustment disorder at 16%. So having a look at your disability management program offering, understanding the trends in the data of how mental health is impacting your specific business will allow you to then decide what type of external partnerships will assist with, again, mitigating the duration, assisting your employees in a preventative measure, but then also having the right resources and tools to effectively manage those mental health cases when they do, roll into your disability management offering. And I know, through Acclaim's experience, what we're noticing, and I'm sure of it throughout the industry as well, is with our current pandemic state, of course, with the changes with COVID, how we know that will impact some employees' well-being and their mental health when it comes to transitioning back into the workplace or continuing to manage, that work-life balance with some of the challenges and barriers that this pandemic has imposed, not only, in the working group, but for your workers as well. So it's important to ask yourself that question for your organization to be prepared for what may come through that door once we transition back through the reopening and through these phases of how mental health is impacted, or how your employees' mental health is impacted through this. And it's important to have those resources in place to effectively manage that. So I'll pass it over to Jessica, who will give you a bit more information about another strategy that can be implemented in your organization to effectively deal with this.
Perfect. Thank you so much. So as mentioned, there's some different strategies that you can employ to kind of help employee mental health. So on the job site, it's really important that employers start with a commitment to foster a positive mental health environment. Having an open conversation about mental health and not shying away from the topic is key. So these strategies are some of the ways that you can help support your employees and just people in general with their mental health. So you don't have to implement these all right off the bat, but there are just some tangible ways to get the ball rolling. So the first one is encouraging a work-life balance. It's so important that people have a balance of time spent at work versus time spent engaging in personal activities. So encouraging family time and promoting employees' hobbies or family life outside of the office can be really important. When there's an imbalance between work and home life, people are at a significantly higher risk of developing stress, burnout, and other mental illnesses. So this should also include setting limits on workplace emails, text messages, or phone calls past office hours, and making sure that this policy is communicated to all your employees. It's also important to vocalize that it is acceptable to not respond to those messages if it is past working hours. On the job site, a way to kind of take this to another level is to hang a sign on the door reminding employees to maybe take 2 breaths and leave work at the door. Like some type of visual as a cue for them to further support that separation of work and home life. The second is including options for people to increase their physical activity. So movement and the brain are intrinsically interconnected, and so exercise is just as beneficial for the mind as it is for the body. Engaging in regular physical activity can reduce symptoms of anxiety, depression, can boost self-esteem, minimize that stress response, and improve cognitive performance. So this may be having a treadmill or a basketball hoop nearby, or even offering or suggesting to maybe take a walk during lunch breaks. So with COVID-19, and we're limited right now in terms of that physical engagement to practice distancing. This can be something like individualized yoga or taking that time to each play that basketball game. So the third option, or the third one, is to show appreciation and gratitude. So research has shown that practicing gratitude regularly can help increase well-being and reduce anxiety, depression, and overall stress. So a quick way to do this on the job site is to start a jar or a whiteboard where people can contribute throughout the week. So this can include messages like, I'm grateful for Jack's awesome sense of humor, or I appreciate the amazing team we have here. There's been several studies that show everyone has a different way that they feel most appreciated, that they express that appreciation as well. So this includes things like words of affirmation. So hearing thank you, you rock, good job, acts of service. So offering to provide some help or guidance for maybe a tough project that someone's facing. Quality time. So incorporating team building activities or periodically having lunch with coworkers. Tangible gifts. So bringing like a box of donuts randomly. And then there's appropriate physical touch. So this only includes high fives, handshakes, or like a fist bump. The fourth is keeping information readily available on mental health supports. So these can be placed somewhere open where people can have access to them without needing to specifically ask for the resource. This can include brochures or pamphlets on mental health supports in your area, as well as maybe a directory of phone numbers for resources that offer services to varying populations, including things like, LGBTQ+, visible minorities, individuals of trauma or domestic abuse, First Nations, etc. So it's important to ensure a sense of inclusion and acknowledgement of the diverse needs of employees. As Brynn mentioned earlier, having EAP or EFAP available is a wonderful way to support employee mental health and letting them know that it's important to take care of themselves as well. This can be used for stress management or a more in-depth CBT or trauma-informed care to address deeper concerns of mental illnesses like anxiety, depression, PTSD, etc. This being offered as an ongoing support as well, so not just to address or treat the concern, but be available to employees as a maintenance of sorts can be really important. So the next one is having on-site support or normalizing self-care. So this can include an open door policy for people to debrief if they're having a particularly bad day, and doing this without fear or judgment of consequences. The objective is not to counsel or to provide therapy, but to just provide a listening ear. So as human beings, when we can get things off our chest, we no longer feel a strong pull to ruminate and internalize and replay these scenarios in our head. So that communication just from one human being to another can be so impactful and deeply increase a person's sense of self and overall their mental health. The sixth one is slowing down. So oftentimes we're in such a rush, and the question, how are you, has become an extension of our hello. So the question has kind of lost its meaning, and it's asked without any intention of hearing the true response. So taking a second to slow down and ask with intention, how are you, can go a long way. This can be done in a comfortable space, not in front of other employees or, in a big open area, just somewhere where they may feel comfortable and not necessarily put on the spot. So the next one can be creating a Mindfulness Mondays or Wellness Wednesdays. So implementing and participating, so that part's really important as well, to participate in a regular form of stress management and or ongoing mental health support. This can further that commitment as a workplace to create a positive environment and foster employee mental health. So things like guided mindfulness sessions once a week by a trained facilitator, or video or telehealth facilitators. This has been shown to, again, reduce stress and the cognitive difficulties that people are facing with stress, as well as just increase their mental health and feeling of well-being overall. Having a regularly scheduled mental health support can provide consistency, routine, and a means of building a strong interpersonal foundation to stand up against workplace stress and mental illness. So when we talk about supporting employees specifically who are working from home or working remotely, adjusting to working from home can be very difficult for a lot of people. They're not just working to keep up with the regular productivity demands of their day-to-day job, but also faced with kind of an invasion of their personal space. So often people come home from work and kind of take off their employee hat. However, when we're working from home or the work is now in their home, it can be extra difficult to retire the employee hat for the evening and wear the parent, spouse, friend, etc. hat. So the first point to supporting employees who are working remotely is to build in opportunities for team debriefings via Zoom or another media platform. This can be really impactful as well because it can be really lonely working from home, and employees can feel left out of the loop. So to encourage communication and workplace collaboration, as well as acknowledging that employee's importance as part of a team, can be really helpful and make people feel like they matter. These video sessions can help solidify that sense of structure, belonging, and purpose that we need as human beings. So we have a need to connect with others, and when we're suddenly no longer at work, we can feel that need tenfold. So the second point expands on that a little bit, but to offer one-on-one check-ins with the employee via Zoom. Because we may not be able to spot those warning signs that I talked about a bit earlier when an employee is working from home, offering a one-on-one check-in can be a great way to let someone know that you're still there to provide that support and just to see how they're doing. The third point, or lastly, right, is considering a monthly mental health newsletter of sorts, and that can contain some of those warning signs, contact information for mental health supports, community resources, as well as maybe some positive events that are happening in the community or at the job site that are completely unrelated to mental health. just to once again encourage that balance of work and leisure and just increase an overall positive experience for people. So I'll pass things back over to Brynn and she can wrap up.
Thank you so much, Jessica.
Welcome.
In conclusion, reducing the stigma, investing in mental health, and promoting a supportive culture are integral to reducing the occurrence of mental health-related disability claims. By implementing a holistic mental health and wellness program and partnering with distinguished care providers, you can facilitate a reduction in these claims as well as a successful return to work process. So thank you for listening, and we'll now move forward to our question and answer period. Okay. Looks like we have a question from Jada. Question for Tania. Have you seen the effects of COVID-19 and STD claims increase over the last couple of months? People taking leave due to the virus? And if not, how do you think it will affect employers for the remaining 2020?
Hi, Jada. That's a great question, and a question that a lot of employers, are faced with and dealing with. So what I can say in terms of our experience, what we've seen with our clients, there certainly has been an increase, and what I'll call it is in program utilization. And the reason I phrase it like that is because some of those cases may fall into, the quote unquote definition of a short-term disability program, whereas other absences related to either the indirect effects of COVID, such as, those perhaps with immunocompromised who are not currently disabled, but potentially face a greater risk due to COVID, or those perhaps who are dealing with childcare issues and can't report to work. So I will say that we've personally seen an increase in program utilization and accessing the resources, and there certainly has been an increase as a result of that. I will say that that's leveled out, I would say, in the past. And again, this is a very fluid, ever-changing, situation. So for the first 2 months, I would say, mid-March when the pandemic started, or at least started impacting numbers, I would say mid-March and all of April, and now towards the later half of May here, we are seeing those numbers curb. But what I think we're going to move into next is, as operations and businesses prepare to reopen, is having those conversations with employees, again, who are either impacted by COVID directly or indirectly, and how that may impact absences moving forward. So I certainly think there will be an impact. And again, just having the right strategies and tools in place to address those concerns, but then effectively manage them if and when they do impact your business, will certainly be important in navigating through the remainder of the year, and in terms of how COVID will impact absences for sure.
Thanks, Tania. If there aren't any other questions, we'll wrap up and make sure to send out the recorded copy of this. And if you do have any follow-up questions, please feel free to email any of us, and we'd be happy to answer and share the response with other attendees. With that said, thank you for attending, and we look forward to our next webinar. Have a great day.